More than 20 million men suffer from low testosterone in the United States alone. But what are the signs? What does it mean for your health? And what can you do about it? In this video, we're going to answer these questions and much more. What is low T? Testosterone is one of several hormones produced by the glands in your endocrine system. Specifically, testosterone is a hormone produced primarily by the testicles that plays an essential role in male sexual development during puberty. It also serves many important functions throughout your life. The tricky thing is that testosterone levels fluctuate constantly throughout the day, depending on various factors such as age, stress, diet, and exercise. As a result, there isn't a simple one-size-fits-all answer when it comes to identifying what's normal. However, there are some general guidelines that can help us get an idea of where your testosterone levels fall. According to the National Library of Medicine, total testosterone levels in men aged 20 to 34 should be around 300 to 900 nanograms per day. For those aged 35 to 69, the range drops slightly to 200 to 850 nanograms per day. Keep in mind that these are just averages and standard deviations. Some people may have lower or higher levels and still be perfectly healthy. That said, consistently low testosterone can increase the risk of certain health problems, which we'll talk about shortly. How do you know if you have low T? Low T can cause a number of physical and psychological symptoms, but many of them are non-specific and can be caused by other conditions as well. This is why it's important to see a doctor if you suspect you have low testosterone, so they can run tests and determine the underlying cause. That said, here are some common signs and symptoms of low testosterone. Low libido. Asterisk. If you've noticed a decrease in your sex drive lately, it could be due to low testosterone. Libido refers to your overall desire for sex, and testosterone is one of the hormones that influences it. So if your testosterone levels drop, your libido may take a hit as well. Erectile dysfunction. Another sign of low testosterone is erectile dysfunction, or the inability to achieve or maintain an erection firm enough for sex. Testosterone plays a key role in regulating your body's production of nitric oxide, a compound that helps to relax smooth muscle tissue and promote blood flow to the penis. So if you're experiencing difficulties in this area, it could be due to low testosterone levels. Reduced muscle mass and strength. Asterisk. Testosterone is responsible for the development of male sexual characteristics during puberty, such as the growth of facial and body hair. It also plays a role in maintaining muscle mass and strength. So if you've been working out regularly but are still having trouble gaining or maintaining muscle mass, it could be because your testosterone levels are on the decline. Increased body fat percentage. Asterisk. Low testosterone levels can lead to changes in body composition, including an increase in body fat percentage. When your testosterone levels drop, it can cause your metabolism to slow down, leading to weight gain. Additionally, testosterone helps regulate the distribution of body fat. So when it's lacking, you may notice that you're storing more fat around your midsection. Fatigue and depression. Asterisk. Low testosterone levels have been linked to increased feelings of fatigue and depression. This could be due to the role testosterone plays in regulating sleep patterns and mood. Studies have shown that people with low testosterone levels are more likely to suffer from sleep apnea, a condition in which a person's breathing repeatedly stops and starts while they're sleeping. Sleep apnea can disrupt sleep quality and contribute to feelings of fatigue and depression, decreased motivation and difficulty concentrating. Asterisk. If you're feeling unmotivated and seem to focus on tasks, it could be due to low testosterone levels. Testosterone plays a role in regulating cognitive function and has been linked to improved memory and concentration. Studies have shown that people with low testosterone levels are more likely to experience symptoms of attention deficit hyperactivity disorder, or ADHD, making it difficult to stay focused and motivated. Hair loss and thinning eyebrows. As mentioned earlier, testosterone plays a role in regulating the growth and distribution of body hair. This includes hair on your head and eyebrows. In fact, many people experience both hair loss on the top of their head and thinning of their eyebrows at the same time. This condition is known as androgenic alopecia. It happens when your scalp starts becoming less sensitive to testosterone and your hair follicles shrink, leading to thinner hair and eventually hair loss. What are the risks of low testosterone? When testosterone levels are low, it can increase the risk of developing certain health problems. One of these is obesity. As we discussed earlier, low testosterone can cause your metabolism to slow down, leading to weight gain and an increased body fat percentage. Obesity increases the risk of developing other health problems such as type 2 diabetes, heart disease, and stroke. Low testosterone has also been linked to an increased risk of osteoporosis, a condition in which your bones become weak and brittle. Testosterone helps regulate bone density, so when levels are low, you may be at a higher risk of developing osteoporosis and breaking a bone. Finally, low testosterone can increase the risk of cardiovascular disease. Several studies have found that low testosterone levels are associated with an increased risk of heart disease and stroke. This could be due to the role testosterone plays in regulating cholesterol levels. People with low testosterone may have higher levels of LDL, or bad cholesterol, and lower levels of or good cholesterol, which can increase the risk of cardiovascular disease. What can you do about low testosterone? There are a few things you can do to help boost your testosterone levels naturally. These include eating a healthy diet, getting regular exercise, and managing stress effectively. You should also limit the use of alcohol and drugs, as these substances can negatively impact your testosterone levels. In addition, there are certain supplements that have been shown to be effective in boosting testosterone levels. These include zinc, magnesium, and ash. If your testosterone levels are significantly low, your doctor may recommend hormone replacement therapy, or HRT. With HRT, you'll receive testosterone in the form of a gel, patch, or injection. While HRT can be effective, it's important to be aware of the potential side effects before starting treatment. These can include acne, mood swings, and an increased risk of prostate cancer. Can testosterone levels improve on their own? Yes, it's possible for testosterone levels to improve on their own. However, this is not always the case, and it depends on the underlying cause of the low testosterone. For example, if low testosterone is caused by stress, getting regular exercise and practicing stress-reducing techniques such as yoga or meditation may help boost testosterone levels. Similarly, if low testosterone is caused by obesity, losing weight through diet and exercise can help improve testosterone levels. However, if there is an underlying medical condition causing low testosterone, such as testosterone levels may not improve on their own, and hormone replacement therapy may be necessary. When should you see a doctor about low testosterone? If you're experiencing any of the symptoms we mentioned earlier, it's important to see a doctor to rule out any underlying medical conditions. In particular, you should see a doctor if you're experiencing symptoms of low testosterone and are also over the age of 65, have a family history of low testosterone, or have other risk factors for cardiovascular disease, such as high blood pressure or diabetes. A doctor will perform a physical exam, review your medical history, and run blood tests to measure your testosterone levels and look for other abnormalities that might be contributing to your symptoms. Based on the results of these tests, your doctor will recommend a course of treatment. This may involve lifestyle changes, medication, or hormone replacement therapy. Are there any lifestyle changes that can help improve testosterone levels? Yes, there are several lifestyle changes you can make to help improve your testosterone levels. First, eat a healthy diet, rich in fruits, vegetables, whole grains, and lean protein. Avoid processed foods and sugary drinks, as these can contribute to obesity and other health problems that can negatively impact testosterone levels. Second, engage in regular physical activity. Exercise has been shown to help boost testosterone levels, so aim for at least 30 minutes of moderate intensity exercise most days of the week. Third, practice stress-reducing techniques. Chronic stress has been linked to low testosterone levels, so it's important to find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. Fourth, limit alcohol consumption and avoid drug use. Both alcohol and drugs can negatively impact testosterone levels, so it's important to use them in moderation or avoid them altogether. Finally, get enough sleep. Sleep is essential for maintaining healthy testosterone levels, so aim for 7 to 8 hours of sleep each night. We hope this video was helpful in providing you with information about low testosterone. Remember to consult with a doctor if you suspect you have low testosterone or are experiencing any of the symptoms we discussed. With proper diagnosis and treatment, you can help improve your testosterone levels and overall health. Thanks for watching. Be sure to like and share this video if it was helpful. And don't forget to subscribe for more health and wellness tips.